Hello friends, today I'm going to discuss about traction alopecia, which is a very important cause of hair loss, especially in people like Sikhs who wear turbans and they lose hair from the sides. So I'm your friend Dr. Shail Gupta and I'm a hair transplant surgeon who has been practicing for almost 20 years now. So see, traction alopecia happens because of a constant pull which is there on your scalp, on your hair. So it can affect males as well as females. So when do we see traction alopecia? What are the causes of traction alopecia? See, most common cause, people who wear turban, like Sikh community in India who wears turban, they tie their hair tightly and then have a knot kind of a thing there. So this has a constant pull, and over a period of many years, this pull leads to a lot of inflammation in the hair roots, and the hair roots are damaged and the hair loss is there. Initially, it is reversible, but later on, as it progresses, it becomes irreversible and these hair don't come back. Traction alopecia can also be seen in patients, in female patients who wear braids, tight braids, or sometimes, when they uh, keep their hair very tight, or they use a lot of pins, or, clutchers, tight clutchers. So this can also lead to hair loss. Mostly it is at the hairline. In the frontal area, we see broadening of hairline, recession of hairline, thinning in that area, and initially it is reversible, but later on it can also become irreversible. Then it can also be seen in patients who wear patches, like who use clips to fix their patches, and this can be seen because of constant pull over the clip areas. So there is a variant of traction alopecia, that's a disease in fact, that's called trichotillomania, where people have a tendency to pull out their hair. So initially it is reversible, these hair come back, they have some psychological problems, disturbance, and they pull their hair out. So now coming to treatment of traction alopecia, first of all, one has to stop the cause, like find out the cause, and if it is traction alopecia, then obviously one has to remove all the causative factors for traction. If you are tying a turban, it has to be very loose. If you are using clutchers, again it has to be loose. If you are pulling your hair backwards like this and long hair, making a pony, maybe you can do side parting, that helps. Now if it is long standing and it is irreversible, then in that situation, hair transplantation is the only solution. So in such cases, one has to be very careful, because of scarring, the graft acceptance might not be that well. One has to choose an experienced surgeon for this, and usually in Sikh pattern baldness, traction alopecia, there is loss of temples, and they are pretty deep, as you can see in these patients, where the temples are pretty deep and they have gone like way too behind. So in such cases, creating a temple, it consumes a lot of grafts and it needs a lot of artistic skills. If you have that, then only you can design it, otherwise it is very difficult. I have seen a lot of patients coming to me for repair transplant cases. They have got their surgeries done, but they are not really very happy with their hairlines. So traction alopecia, one has to be very, very careful. Usually we need a good number of grafts if we are bringing the hairline down. In most of the cases, it is somewhere, not less than 3000. However, if you are not bringing the hairline too down, then, even then you need good number of hair in the temple area. So the surgery can be done without shaving off your head. A lot of people, especially Sikh patients who have some religious, sentiments attached to shaving off the head, we do the surgery without shaving off the head. And even a long hair transplant surgery can also be done in such patients, where by taking out a strip, not cutting the hair in length, we can implant long hair directly on the scalp. That also is a very, very helpful technique, but it needs a lot of skills, expertise. Not everybody can do this. So I'm sharing a few cases of traction alopecia with you. Just have a look. We created the temples, we created the side locks, and we merged these hair in the existing hair, lowered the hairline. So because of scarring, we cannot put the grafts too close. There is a risk of ischemic necrosis. The sometimes graft acceptance is not that good. So one has to strike a right balance. Sometimes we do a test patch also in such patients of say 100 hair and wait for 3-4 months and check the hair growth, and if the graft acceptance is good, more than 80-90%, then we can go ahead with the surgery. But that is mostly not needed in many cases. I mean, we have enough experience to deal with such cases. So if you see this patient, so we did 3,500 grafts for this patient, and you see how nicely the temples and the sideburns were covered, and obviously we didn't shave off the head, and the donor area was also hidden from day one. So if you see the surgeries, post-op pictures, it looks good. And if you see the 15 days post-op picture, the hair have grown in length and the scabs have fallen, and it looks pretty good. And this patient was from London, and he went back and he sent his pictures for follow-up, and if you see, the result looks awesome, amazing. A finished result with very good density and very natural looking hairline, and the temples have also merged very, very nicely. So it is my request to you guys, if you are really interested in getting a good hair transplant, and if you are suffering from traction alopecia, you really need to do your research. Just go through the pictures, go through the gallery, see if similar kind of hairline is made for every patient. It is more or less flattish kind of hairline with very pluggy kind of grafts put in the hairline. That is not good. And if somebody has got his hair back who was bald, it means everything to this person. He will be very happy, but he might not be knowing that this could have been done uh, in such a wonderful and perfect way. So it would have looked so nice, that they can't even imagine. So I always tell my patients that, if you haven't watched Sachin Tendulkar's batting, you might consider Anil Kumble as a very good batsman, So, so hair transplantation in traction alopecia cases requires skills, art, science, and experience. So if you have any questions, doubts about this, you can, contact me and my team on the given numbers. You can write in the comment section. And if you like the video, please press the like button. And if you want me to make videos or share some results, more results of traction alopecia with you, write it in the comment section. You can contact me on the given numbers also, as well. Go through the gallery of our website where you will find a lot of cases, and that's it. So I'll do a live session on traction alopecia. So if you want to be a part of it, register yourself at the given number. The form is given in the description. Okay. So thank you very much for watching the video till end, and love yourself. Stay blessed.